Hello, I'm Dr. Jon Perlman, Beverly Hills plastic surgeon and extreme makeover plastic surgeon. A lot of people are curious about facelift procedures. Everybody wants to look young and look refreshed and energized, but everybody fears having an unnatural look, having everybody go, wow, so-and-so had a facelift as soon as they return to work. So how can you obtain a younger, more youthful, refreshed look and not look like you've obviously had a facelift? Well, that's key. It's very important in my practice at least, because people don't want it to be obvious. So what I've developed is a technique over the many years I've been doing plastic surgery that camouflages the incisions. I believe in lifting the muscles and lifting the deep plane, but I also believe in removing a reasonable amount of skin so that the result is long-lasting. As an example, I recently reoperated on a patient of mine whose facelift I'd done 18 years ago. Prior to that, I'd had a patient whose facelift was done 16 years before. On average, I think most facelifts last about 10 to 12 years, but we can obtain a natural look and a long-lasting result for most of our patients. So with techniques that are designed to look natural, we can lift and reestablish volume in the face with fat grafts that transfer stem cells without having a pulled look and without having visible incisions. For example, patients can have an incision design that doesn't change the sideburns, that doesn't lift them up unnaturally, forcing you to style your hair over the front of your ear for the rest of your life. I'll show you an example of one of my patients' facelift incisions. And basically what you'll see is that it's hard to tell if there's been an incision there. Why? Because the sideburn hasn't been altered. In comparison, here's a patient who lost her sideburn from a poorly designed facelift incision done many years ago by somebody else. Additionally, behind the ear, there's a way to make the incision so that the hairline doesn't change. Here's an example. Versus an incision where the hairline has been altered and there's a wedge of hairless skin that always has to be covered and can only be treated either by camouflage with your hair or with hair grafts. So these are important features that allow me to remove a lot of skin for those who really need their jowls lifted and the excess skin of their neck pulled up without giving telltale signs that will embarrass somebody at a party when somebody notices that you have no sideburn, for example. Additionally, it's important to camouflage the incision in front of the ear so that it's not a continuous line. So it goes behind this part of the ear, and it does a beautiful job of making it unobvious or difficult to tell that surgery's been done. So think about these things when you're choosing a surgeon for a facelift. Make sure you see before and after pictures as well as close-ups of the incisions, because it does matter, and you'll be carrying those incisions with you for the rest of your life. Thanks for listening. I hope to see you soon. Call us if you have any questions, 310-854-0031, or visit my website, www.perlmanmd.com, and look under the procedures, facelift and neck lift, and I hope you found it worthwhile. I enjoyed talking to you. Have a good day.